Hello to all dear students. In this video, we'll be discussing about beta-lactam antibiotics. So, this beta-lactam, it is actually a chemical name. There is a chemical ring which is a beta-lactam ring. It consists of 4 carbon atoms. All the beta-lactam antibiotics has this ring. Now, most of the antibiotics also have one more ring which is different in different beta-lactam antibiotics. So, based on the second ring, we have got different types of beta-lactam antibiotics and we shall check them out one by one. So, the first one goes like this. This is your beta-lactam nucleus. Here to this is attached a second ring. The name of this ring is thiazolidine ring. Okay. Now, over here at this part of the beta-lactam nucleus, we have got a side chain attached. Now, the name of this compound is penicillin. Okay, so penicillin is one of the example of beta-lactam antibiotic. Now, we shall check out the another one. This is your beta-lactam nucleus. Here to this is attached a second ring. The name of this ring is dihydrothiazine ring, and similar to penicillin, even this has got a side chain attached which goes like this. The name of this compound is cephalosporins. Okay, so we got two names of beta-lactam antibiotics. First one is penicillin and second one is cephalosporin. Now going to the third one, this is your beta-lactam nucleus. To this a ring is attached. This one is the ring, and here also this has got a side chain. Not that lengthy. Name of this compound is carbapenem. Okay, so penicillin, cephalosporin and carbapenem are the examples of beta-lactam antibiotics. So we shall check out another one. This is your beta-lactam nucleus. Ring is not there, but a side chain is there. Name of this compound is monobactam. Okay, so this is your beta-lactam nucleus, and the examples of beta-lactam antibiotics are penicillin, cephalosporin, carbapenem and lastly monobactam. And as you can see, all of them contains the same beta-lactam ring, but the second ring is different in different antibiotics. But in case of monobactam, this ring is absent, means as the name says mono, that means they contain only one ring, and that one ring is the beta-lactam ring. Okay, so these all are the examples of beta-lactam antibiotics. Now one by one we shall check out all these things. So starting our discussion with penicillins. Alright, so penicillin. Initially used penicillin was penicillin G, which was also known as benzyl penicillin. Now this penicillin has a lot of limitation. So first of all we shall check out the limitations of penicillin G, and then we shall discuss like how to overcome all these problems. Okay, so first of all we shall check out the limitations of penicillin G. So the first problem was it cannot be consumed orally. So we need to give it by injection. Second problem is it is very short acting. So need to be given several times a day. Third problem is its narrow spectrum. Penicillin G are mainly effective against gram-positive bacteria. It has very less activity against gram-negative bacteria. This shows its narrow spectrum. Next problem is we know that it is effective against gram-positive bacteria, but even those gram-positive bacteria that were initially sensitive, they have now become resistant to penicillin G. So development of resistance is the another problem. Next is Penicillin G can also cause allergy. In fact, it can also cause anaphylactic shock. So these all are the limitations of penicillin G. Next, we shall try to discuss about how to overcome all these problems. So tackling with the first problem, that is it cannot be consumed orally. Now, what is the reason why it is not effective orally? The reason behind that is penicillin G are acid labile. Acid labile means whenever we are consuming penicillin G orally, it is being destroyed, it is being damaged by the acid, it is being broken by the gastrointestinal acid, hydrochloric acid. Okay, so acid can break it down, and so when it is broken down, it cannot be absorbed. Okay, so this is the problem. Now, what might be the solution for this? Solution to this is we have to develop pure penicillins which are not broken by acid. They can be given orally. Now these penicillin are called as acid resistant penicillins. So because they are resistant to acid, they can be given by oral route. They are also known as oral penicillins, and the examples are penicillin V, also known as phenoxypenicillin, oxacillin, dicloxacillin, cloxacillin, and amoxicillin. So these are the examples of acid resistant penicillin. You can remember these names by the mnemonic vodka. Okay, so these are the first class of penicillin, that is acid resistant penicillin. Now the first problem is being solved by this vodka penicillins, you can say. So now going to the second problem, that is short acting. Second problem with penicillin is they are short acting. Now the reason for short acting of penicillin is they are rapidly secreted. They are rapidly secreted. Okay, and after getting secreted, they will be eliminated out from the urine. So penicillin will act for only 2 to 3 hours. So we need to give penicillin several times a day. Now, what is the solution to this problem? One solution is if we inhibit the tubular secretion. If penicillins are not secreted, then they will remain in the blood for a long time and become long acting. And this problem can be solved, and this can be done by giving another drug, that is probenecid. Probenecid competes with penicillin for tubular secretion. So, when both penicillin and probenecid are present, only one out of the two can undergo tubular secretion. Probenecid have higher affinity for the pumps, so obviously probenecid keeps on going out. So penicillin cannot go out, so it stays in the blood and keep on acting for a long period of time. So you can say probenecid increases the duration of action of penicillin by inhibiting their tubular secretion. This is one method by which we can increase the duration of action of penicillin. We have got another method by which we can increase the duration of action of penicillin, and this can be done by making a special preparation which is known as a depot preparation. Depot preparation means these are the preparation where the drug will be deposited somewhere, like if we give penicillin by intramuscular route and it is deposited in the muscles, they will be called as depot preparation. Like an example is benzathine and procaine. So if we attach this benzathine to penicillin G, or if we attach procaine to penicillin G, so these compounds, they will hold the penicillin G in the muscle itself. Now the meaning of this depot preparation is, suppose we give nearly 1000 molecules of benzathine penicillin G by intramuscular route. So penicillin G has come here in the muscle, but it will be deposited in the muscle. See, normally if we give penicillin G alone penicillin G, if we give via the intramuscular route, then almost all the penicillin G will come into the blood, and afterwards they will get eliminated out by 2 to 3 hours. But instead of penicillin G, if we give benzathine penicillin G by intramuscular route, then what will happen? Out of 1000 molecules, only 100 molecules have come into the blood. So these 100 molecules will produce the action for 2 to 3 hours, and after that they will be secreted out and thrown out of the body. So when they go out of the body, then another 100 molecules from the muscle will come into the blood, and they will work for another 2 to 3 hours. Again they will go out. Now 100 more molecules will come into the blood from the muscle. So in this manner the drug keep on coming into the blood and its duration of action will be increased. So this preparation will increase the duration of action of benzathine penicillin G. And this benzathine penicillin G is the longest acting penicillin. Now, suppose if we give benzathine penicillin G by intravenous route, then what will happen? Yes, benzathine penicillin G, when it is given via the intravenous route, obviously the drug cannot be stored in the muscle. All the drug will produce the action and thrown out of the body. So that means their action will terminate within 2 to 3 hours. So there is no use in giving these drugs via the intravenous route. Therefore, benzathine penicillin G and procaine penicillin G, they are always given via the intramuscular route, so that they are stored inside the muscle and slowly will release for producing the action. Okay. So this is how by which we can solve the second problem, that is the short acting of penicillin. Now coming to the third problem, okay, that is narrow spectrum. Now first of all we'll discuss the spectrum of penicillins. Penicillin G is mainly effective against gram positive bacteria. Gram positive bacteria mainly includes cocci like streptococcus and staphylococcus. It also includes gram positive bacilli like Bacillus anthracis, which is causative bacteria for anthrax, and even Clostridium, which is causative organism for tetanus and gas gangrene. Now among gram negative bacteria, it is effective against gram negative cocci, which is normally Neisseria, both Neisseria meningitis and Neisseria gonorrhea. But the main problem is penicillin G is not effective against gram negative bacilli. And gram negative bacilli are the biggest group of bacteria. Large number of bacteria are present in this group of gram negative bacilli, like for example E. coli, Shigella, Salmonella, all the Enterobacteria, Protease, Pseudomonas, Klebsiella, all belongs to gram negative bacilli. So penicillin G is said to have narrow spectrum because it is not effective against a large number of bacteria. Its main action is against gram positive bacteria. Now the solution to this is we have developed a newer penicillins which are effective even against gram negative bacteria, and these newer penicillins are called as the extended spectrum penicillins, or simply they are also known as wide spectrum penicillins. The name only says their spectrum is wide, means they can also inhibit gram negative bacteria. Now the examples of drugs are ampicillin, amoxicillin, carbamazepine, ticarcillin, meslocillin, azlocillin, and piperacillin. And you can remember the names of these drugs by the mnemonic ACT map. Okay. So what these all drugs are doing, they are not only effective against gram positive bacteria, but they are also effective against gram negative bacteria. Now one of the most dangerous gram negative bacteria is Pseudomonas. So against Pseudomonas, these drugs carbamazepine, ticarcillin, meslocillin, azlocillin, and piperacillin, these 5 drugs are effective against Pseudomonas also. Ampicillin and amoxicillin are not effective against Pseudomonas. They are only effective against gram positive and gram negative organisms, or basically the cocci. But the rest 5 drugs, that is the CT map drugs, they are effective against Pseudomonas also. So this is how we can solve this problem of narrow spectrum. These are the second class of penicillins. Okay. Now coming to the fourth problem, that is development of resistance. Now to understand this concept, suppose this is a bacteria, gram positive bacteria. So normally whenever we give penicillin G, it will kill the bacteria. Now we keep on giving penicillin G since for many years. Now these bacteria, once they had a meeting, and in the meeting they decided that some persons, they are coming from outside and killing our people, so we will not tolerate this. So what these bacteria did was, they kept these security guards. Now the bacteria has security guards and they are waiting with guns in their hands. Now when we give penicillin G, these bacteria is ready to shoot the penicillin G, and when the penicillin G is shot, it will die. So bacteria will survive. So this leads to development of resistance. That means penicillin G is not able to kill the bacteria, and the name of these security guard is penicillinase. Now penicillinase can also be called as beta lactamase, because penicillin is one of the beta lactam. So penicillinase or beta lactamase are the enzymes that will be produced by the bacteria, which will be breaking the penicillin. So bacteria will become resistant to penicillins. So now we also know that bacteria has security guards. So if we send penicillin G, it will be killed. So what we did is, we give these penicillins a bulletproof jacket. Now the penicillin, this bacterial security guards will be keep on shooting this penicillin G, but because bulletproof jacket, penicillin G will not be killed. Now penicillin G will come to the bacteria and they will kill the bacteria, and the name of this bulletproof jacket is beta lactamase inhibitor, and the drugs are clavulanic acid, sulbactam and tazobactam. See, the name only states they will inhibit beta lactamase of the bacteria. So bacterial enzyme cannot kill the penicillin G. So obviously for their efficacy, they should be given along with the penicillin G, so that they can protect penicillin G alone. See, these beta lactamase inhibitors, they cannot kill the bacteria. Their work is just to protect the penicillin G, and penicillin G will be doing the work. So normally we are giving penicillin in combination with these beta lactamase inhibitors, and the combinations normally used are clavulanic acid along with amoxicillin, sulbactam along with ampicillin, and tazobactam along with piperacillin. Okay, so these are the combinations effective against the bacteria which are resistant to amoxicillin alone or ampicillin alone. Okay, so these are the third class of penicillins. Now this is the one method of preventing drug resistance. The second method is, instead of giving a bulletproof jacket, we can call Rajnikant, because no bullet can touch Rajnikant. So Rajnikant, it can go inside the bacteria and it will kill the bacteria. So these penicillin, which are called as Rajnikant penicillin, their actual name is penicillinase resistant penicillin. The name only says these penicillin are resistant to penicillinase, means even if penicillinase is present, still these agent can kill the bacteria. Now the examples of penicillinase resistant penicillin are cloxacillin, oxacillin, nafcillin, dicloxacillin and methicillin, and we can remember the names from the mnemonic condom. Now among these, the most resistant penicillin is this one, the methicillin. That means if a bacteria is resistant to methicillin, then it is likely to be resistant against to all the other penicillins, and that bacteria is given a special name, that is methicillin resistant staph aureus, abbreviated as MRSA. Now special point to remember for this MRSA is, the resistance to methicillin occurs mainly because of alteration in penicillin binding protein. Okay, see, normally we know will be a penicillin binding protein present on the surface of the bacteria, and whenever we are giving penicillins, this penicillin will be binding with the penicillin binding protein and inhibiting the bacteria. But what happens, what is the special point regarding MRSA is, there is alteration in this penicillin binding protein, means penicillin are not able to bind. So when the penicillin are not able to bind, then no penicillin will be effective. So no penicillin is effective against MRSA. So not only penicillin, even no beta lactam is effective against this MRSA. So regarding MRSA, you need to remember most of the beta lactams are ineffective against MRSA. Now we will discuss later on only beta lactams which are effective against MRSA are the 5th generation cephalosporin, and thus all other beta lactams are ineffective against the MRSA. Okay. So this is the 4th class of penicillin, that is penicillinase resistant penicillin. Now coming to the last problem, that is allergic reactions. Penicillin are the common cause of anaphylactic shock. So we are unable to develop any new penicillin which is not causing allergy. The only thing we can do is we can be careful so that allergy do not become serious. So before giving any penicillin, we should do a skin test, and skin test is done by giving intradermal route the penicillin G. That means we will inject very small dose of penicillin by intradermal route, and we will observe that site for half an hour, that is for 30 minutes. If there is any reaction in that place, means that person is sensitive to penicillins, so we will not give penicillin. If there is no reaction, we can give penicillins. Now one point which is special to remember is, if a person is allergic to one penicillin, the person is allergic to all the penicillin also. This phenomenon is called as cross allergy. Like if a person is allergic to ampicillin, we cannot give piperacillin or ticarcillin or any other penicillin. So due to cross allergy, if a person is allergic to one penicillin, all other penicillins are contraindicated. Now not only penicillins, there is a significant cross allergy between different beta lactam antibiotics also. That means if a person is allergic to penicillins, we cannot give penicillin obviously, but we cannot give any other beta lactams like cephalosporin and carbapenems also. Now the special point to remember over here is monobactams. They do not show cross allergy. Therefore, when a person is allergic to penicillins, we can try monobactams. Monobactams do not show any kind of cross allergy. Okay, so these were the 5 problems of penicillin G and the way by which we can overcome these problems. So with this we have completed our topic of penicillin. So quickly we'll jump over to the cephalosporins. So our next antibiotic is cephalosporins. These are a group of semi-synthetic antibiotics derived from cephalosporin C obtained from a fungus Cephalosporium. And this is the structure. Okay, so you can see it is chemically related to penicillin, since it also contains the beta lactam nucleus which is fused to dihydrothiourine ring. Next, by the addition of different side chain at position 7 of the beta lactam ring and at the position number 3 of dihydrothiourine ring, a large number of semi-synthetic compounds have been produced. When you give any attachment at the 7th position of beta lactam ring, it mainly causes alteration of the spectrum of activity, whereas addition of any group at the 3rd position of dihydrothiourine ring, it mainly affects the pharmacokinetics. Next we shall check out the classification of cephalosporins. See, these cephalosporins, they are mainly divided into 5 generations. They are the 1st generation, 2nd generation, 3rd generation, 4th generation and 5th generation. And this classification of the generation, it is mainly based on their spectrum of activity. Now you can grossly remember, as 1st generation cephalosporin, they are just like penicillin. Just like penicillin means they will be mainly effective against the gram positive bacteria. Now as we move forward from 1st generation to 2nd generation to 3rd generation and to 4th generation, the activity against gram negative bacteria keep on increasing. That means the fourth generation cephalosporins, they are highly effective against the gram negative bacteria. Now you can see first generation are effective against gram negative, first generation is mainly effective against gram positive bacteria. Fourth generation is mainly effective against gram negative bacteria. Now regarding second and third generation cephalosporins, they are effective against both gram positive as well as gram negative bacteria. And amongst this, the third generation cephalosporin, they has the most widest spectrum. Next, special point about second generation is some of the second generation cephalosporins, they are also effective against the anaerobic bacteria. Now we are left with fifth generation. This fifth generation cephalosporin, the special point to remember about this is they are effective against MRSA. These are the only beta lactam antibiotics effective against the MRSA. So grossly, the spectrum you can remember is the first generation cephalosporins, they are effective against gram positive bacteria. Fourth generation are effective against gram negative bacteria. Third generation have got a widest spectrum. Second generation are also effective against some anaerobes, and fifth generation they are mainly effective against the MRSA bacteria, right? Next we shall check out the examples of drugs which are coming under this generation. So for first generation the examples are cefazolin, cefalexin, cefalothin, cephaloridine, and cefadroxine. Next for second generation the drugs are cefuroxime, cefoxitin, cefmetazole, cefomandol, and cefaclor. Next for third generation cefoperazone, ceftriaxone, cefotaxime, ceftriaxone, cefpodoxime, ceftazidine, moxalactam, and cefixime. Next for fourth generation cefepime and cefpirone. For fifth generation the drugs are ceftibiprole and ceftaroline. Okay, so these all are the drugs, the classification of cephalosporin with their examples. Now the next important challenge is how to remember these drugs. See, all these drugs are very much confusing, right? Now check out the first generation drugs. First of all, you can see all the drugs starts with cef, cef, but if after cef if there is a, that means that that drug belongs to the first generation. Okay, after cef wherever you will say if a is there after cef, that means that drugs belongs to the first generation. But this has got one exception. Check out the second generation, we have got cefaclor. Okay, here also after cef a is there, but this cefaclor, it does not belongs to first generation, it belongs to second generation. And as anywhere if after cef a is there, that means those drugs belongs to first generation. Next, if suppose pi is there, cef is there, and after cef if pi is there, check out the fourth generation, if pi is there, that means that drug belongs to the fourth generation. Okay, next if suppose after cef a is absent, pi is also absent, but if role role is there, check out the fifth generation, if after cef a is not there, pi is not there, but role role is there, that means that drug belongs to the fifth generation, right? Now next you check out the third generation, if after cef a is absent, if pi is absent, rol is also absent, but if the drug is ending with me, or if it is ending with one, that means that cephalosporin belongs to the third generation. But you can see moxalactam, it is something different which you can remember. Okay, if the drug is ending with me or one, that means that drug belongs to the third generation. But this has got one more exception. Check out the second generation. You can see cefuroxime, it is ending with me, but it does not belongs to third generation, it belongs to second generation. Okay, so you can see if any drug is of first generation, means after CEF A should be there, but one exception is cefaclor of second generation. Next, if PI is there, that means the drug belongs to fourth generation. If role is there, the drug belongs to fifth generation. Next, if a drug ends with me or one, that means the drug belongs to third generation. Now, all the remaining drugs where there is no A after CEF, if there is no PI, no role, no me, no one, that means the drug belongs to the second generation cephalosporin. So this is one of the way by which you can remember the examples of drugs of cephalosporin belonging to their different generation. Next, we shall check out some of the important points regarding cephalosporin. The first point is almost all the cephalosporins are eliminated out by renal route except cefoperazone and ceftriaxone, because these two drugs, they are eliminated via the bile, they are secreted in bile. Okay, now what is the importance, why we want to know whether these drugs are eliminated by bile or not? Like, the thing is, almost all the beta lactam antibiotics, they are mainly excreted by the kidney, by the renal route. So if there is any kind of renal failure, they will get accumulated and they will lead to toxicity, right? But on the other hand, if a drug is secreted by the bile, then what happens? If the drug is secreted by the bile, means via the this biliary secretion, they will enter into your GIT tract and it get eliminated out via the fecal matter. Okay, so that means if we have an extra pathway through which the drug can go out of the body, so even if a person is having renal failure, this means that the drug is safer. Okay, so that these two drugs, cefoperazone and ceftriaxone, these two drugs does not require any kind of dose adjustment in case of renal failure, because they are eliminated by the biliary secretion. Next important point is which cephalosporin are effective against pseudomonas. Okay, see, many drugs are there which are effective against pseudomonas. Now among cephalosporin, we have got four cephalosporins that are effective against pseudomonas. They are cefepime, cefpirone, cefoperazone and ceftazidime. Okay, so you can see the first two drugs belongs to fourth generation since it contains PI, and the another two drugs, they belongs to third generation since they end with 1 and ME. Okay, so these are the four drugs which are mainly effective against pseudomonas, and among these ceftazidime, they are most effective against pseudomonas. Next thing is disulfiram like reactions. There are some drugs, when they are given with alcohol, they causes a reaction which is called as disulfiram like reaction. So some cephalosporins can interact with alcohol, so they should be avoided in alcoholic patients, and whenever they are given to a person, the person is instructed that not to consume alcohol. And these cephalosporins include cefoperazone, moxalactam, cefotetan and cefomendol. Okay, so these four drugs have got disulfiram like reaction, so they should be contraindicated along with alcohol. Next special point about these four drugs are, these four drugs can also cause a problem known as hypoprothrombinemia, means they can decrease the prothrombin level, which will predispose a person to bleeding. Therefore, they should be avoided in a person with bleeding tendency, like patients with hemophilia. We should not give these cephalosporins. Okay, so this was all regarding cephalosporin. Next, we shall start our discussion regarding the carbapenems. Alright, so starting with carbapenems, kind of beta lactam antibiotics. The main drug in this group is imipenem. When we tested imipenem in the laboratory, it was highly effective. It could kill most of the organisms, including the gram positive, gram negative, and even the pseudomonas. Okay, so these were effective against almost all the bacteria. Even they had the ability to kill the anaerobic bacteria. So in the laboratory, this imipenem, it was killing almost all the organisms. So we were very much excited. So next what we did is we tried imipenem in humans. So when we tried imipenems in human being, it did not kill even a single bacteria. We were surprised because in the laboratory it was killing every bacteria, but in the human body it was not killing even one. So when we thought of the reason, and it was found that our kidneys, they are producing an enzyme. The name of this enzyme is dihydropeptidase. So this dihydropeptidase enzyme, these are mainly breaking the imipenem. And when imipenem is broken, obviously it will not work. So then what we thought of a strategy is, what if we inhibit this enzyme dihydropeptidase? Okay, so what we thought is, why not to inhibit this enzyme? So when this enzyme is inhibited, then imipenem will not be broken. So when it is not broken, it will become effective. So therefore we developed a drug which will inhibit this enzyme, and the name of that drug is cilastatin. So next, when we gave imipenem with cilastatin, it was able to inhibit all the organisms, okay, gram positive, gram negative, as well as pseudomonas. It was effective against all the other bacteria. So therefore now imipenem is always given in combination with cilastatin. Next, the main side effect of imipenem is it will produce seizure. Therefore, these drugs are contraindicated in epileptic patients. But imipenem is highly effective, very broad spectrum antibiotics which are effective against even pseudomonas. Next, after imipenem, we developed still more carbapenems, but we kept two things in mind. First one is, imipenems are broken down by dihydropeptidase. Therefore, the newer drugs should not be broken by that. Next thing is, imipenem is causing seizures. So, newer drug should have lesser risk of causing seizures. So therefore in newer drugs we have taken care of these two problems, and the drugs are meropenem, ertapenem, doripenem, and ferropenem. Now, like imipenem, all these four drugs, they are also broad spectrum. That is, they are effective against gram positive, gram negative, pseudomonas, and even anaerobes. But unlike imipenem, these are not broken up by dihydropeptidase. Therefore, they can be given without cilastatin. Next thing is, these four drugs, they have got lesser risk of causing seizures as compared to imipenem. Rest all the other properties are similar to that of imipenem. Now, all these carbapenems, all the carbapenems, they are given by injectable route, but except ferropenem, because these can be given via oral route. Now next thing is, if you remember regarding penicillin, we knew that penicillin had a very narrow spectrum. And what was the reason regarding the narrow spectrum? Yes, because the bacteria, they used to produce their security guard, if you remember. And what the security guard were doing, they were breaking down the penicillin G, right? And now for protecting penicillin G, what we did, no, penicillinase were the enzymes, isn't it? And penicillinase are also known as beta lactamase. And for inhibiting these beta lactamase, what we were doing, we were giving beta lactamase inhibitors, isn't it? So these all are the beta lactamase inhibitors which are given in combination with the normal penicillin, right? Now what happens, these bacteria, they thought that again I should develop one more drug which can inhibit more antibiotics. So they developed an enzyme, okay, and the name of this enzyme is ESBL, that is the extended spectrum beta lactamase. So before we had just beta lactamase. Now these bacteria have developed extended spectrum beta lactamase. So if any bacteria have got this type of enzyme, that is ESBL, extended spectrum beta lactamase, it can break large number of antimicrobial. So now not only beta lactams, even non beta lactams are being broken down by this ESBL enzyme. ESBL, it become resistant to most of the antimicrobials, and it will become very much powerful because almost no antibiotics are able to inhibit these bacteria. And you know which bacteria commonly harbor ESBL? Yes, that is Klebsiella. Okay, so that means any organism or Klebsiella which has ESBL, it is resistant to most of the antibiotics. But you know, this ESBL, it has got two limitation. First thing is, it cannot break carbapenem. So whenever you give carbapenem, it can inhibit the enzyme producing ESBL or the Klebsiella producing ESBL. Next thing is, if we give beta lactams or non beta lactams along with the beta lactamase inhibitors, even they can inhibit these kind of bacteria. Okay, so we have the advantage of these two properties. So the bacteria which is producing ESBL, the drug of choice is carbapenem, because ESBL, they cannot break carbapenems. Second thing is, we can give beta lactams along with beta lactamase inhibitor. Okay, so the common combination we are using is piperacillin and tazobactam. Okay, so this was all about our topic regarding carbapenems. Next we shall start our discussion with monobactams. In monobactams, we have got only one example, that is aztreonam, and we have got two special points regarding aztreonam which is quite opposite to that of penicillin. The first thing is, it does not show cross tolerance. Okay, now this thing is quite opposite to penicillin, because penicillin, they produces allergy, isn't it? And any person who is allergic to one type of penicillin, he is allergic to any other type of penicillin also. Even not only penicillin, that person, if any person who is allergic to penicillin, he is allergic to all other types of beta lactams antibiotics, isn't it? This we have discussed previously also. But any person who is allergic to all type of beta lactams, to them we can give monobactams, because monobactams like aztreonam, they does not show any kind of cross tolerance. Now second important point regarding aztreonam is, they are effective against gram negative bacteria, or you can say they are effective against only and only gram negative bacteria, including pseudomonas. So this point is also quite opposite to that of beta lactam penicillin. Okay, because penicillin, they are effective against only gram positive bacteria, whereas the aztreonam, they are effective against only gram negative bacteria. Okay, so this was all about aztreonam, and this was all about our topic regarding beta lactam antibiotics. I hope you people found this video helpful. Thank you for watching.